Hey guys, welcome to Par Physical Therapy. I am here with Dan Mirdo. He is from the Mirdo Financial Group.
Correct.
We are going to go over some insurance information with you. I'll talk to you a little bit about what that means as far as here in our clinic and physical therapy and what your benefits look like and some different things that I'll discuss with you and so you understand the terminology. And Dan, what are you going to inform them about?
Well, it's that time of year where everyone is just concerned about insurance plans and what's accepted, what's not accepted. We hear horror stories all the time about, people thinking they have one thing and they don't have one thing, or surprise bills, or
Mhm.
just, the part of the headache of Medicare, right? I jokingly say sometimes it's hard for us to understand. I
Yes.
can't even imagine people that aren't in the business. So,
Yep.
yeah, we just want to shed some light on that and, try to help you guys out.
All right. Um, why don't you give the quick rundown as far as Medicare, an Advantage or replacement plan, and then a supplement, just to
Sure.
and what the different supplements are, and then I'll go over some of the specifics as far as what it looks like here.
Okay, yeah. So I'll do a real very, a 2-minute elementary look over with it. So once Americans get to age 65, or if they're on disability for more than 2 years, they qualify for Medicare.
Okay.
So they could be, in their 30s, their 40s. If they're on disability, they qualify for Medicare.
Mhm.
Okay. And Medicare is broken down into two major parts. So you got Part A, and that's going to be anything that's at the hospital. So
Right.
physically at a hospital. Part B, just think outside the hospital, like you guys, for instance,
Mhm.
right? That would be covered under Part B. Um, Now, that is what is commonly referred to as original Medicare. Okay, so that's what everyone gets on. They're taking the money out of your check, $165. That's what that's paying for, the Part A and the Part B. Okay.
Okay.
If you only had that, it is an 80-20% split.
Okay.
So if you go to the ER, if you go to a hospital, basically the Social Security is going to pay for 80%. They're going to bill you for 20%.
And that's regardless of where you go, you said?
Correct.
So any doctor,
Well,
any other doctor's office?
they do have to accept Medicare.
Right.
So your optional, your dentist, your hearing specialist, your eye doctors, they don't have to accept Medicare if they don't want to.
Okay.
Yep.
Okay.
And so really that's kind of where we come into play is, all right, so the client is responsible for 20%. And you think about it, if you have a heart surgery, or if you're in the hospital for,
20% can be a lot.
you're right, and so that's where there's two main, it's Part C is probably what most of you guys are referring to, or heard of. And Part C is, there's a lot of nuance to it. So if I just keep it super high level, it's going to be your Medicare supplement and your Medicare Advantage.
Okay.
So they're basically the same vehicle, and this is where so many people get confused. It's both designed to cover your 20%.
Okay.
So the 80% that the government's paying for, you still have all those coverages. You're not losing that no matter which avenue you go with.
Okay.
Okay. We'll start with Medicare supplement because that is just like a traditional health insurance. You're going to pay a monthly premium whether you use it or not. Right? So
Mhm.
just like the health insurance you had at work or you had when you were younger, you're going to pay. Typically, it's in the neighborhood of $100 to $200. It does go up as you get older, but basically, if you have that, you just show that to the clinic or the hospital, and basically you don't pay any copays or any co-insurances or anything like that.
Okay.
Okay. The downside to it is obviously there is that monthly premium,
Mhm.
and it also doesn't include any of the electives. So dental, vision, hearing, none of that's included. So if you wanted that, you then have to basically sign up for another private plan for those.
Okay.
Okay. You are also required. You have to get a Part D prescription drug plan.
Right.
So if you have a supplement, you are required by law to get a drug plan. If you don't, they will fine you, penalize you. And so then again, it's another, 30, 40, $50 a month for that as well. So you
Okay.
could see, for most folks, sometimes if finances are the issue, supplement might not be an option.
Okay.
Then you have Advantage. So again, it's the same, it's covering the same things, right?
Mhm.
But in lieu of a monthly payment, so there's no monthly payment, you're going to pay copays. So if you go to the hospital, if you go to the doctor, if you go wherever, basically you're going to pay a copay. And that's going to be outlined in the plan.
Okay.
right? And that's where the plans differ. So, the main companies, Humana, United Healthcare, Aetna, um, they're all very similar, but they differ on what they cover and what they charge for a copay.
Okay.
Yeah. Does that make sense?
Yep.
It's also going to have the drug plan included in there.
So it's an Advantage plan is all in one bundle.
Correct.
Okay.
Correct. Yep. And the confusion and kind of the horror stories with the Advantage plans is they are very network specific.
Mm-hmm.
And so if you're not working with someone that's taking the time to figure out who your doctors are, what your medications are, you could end up in a plan that is not ideal for you.
Right.
That basically your provider might not accept that plan. And now it's not doing what it's intended to do.
Okay.
So if you ever heard these horror stories about people that, oh, I had, XYZ company, it was terrible, I had to pay this much money, it's because they had no business being in that plan.
Okay.
Yeah.
Makes sense.
Yeah, good.
At least to me.
Sure.
So Dan had talked about, the co-pays and the co-insurances. Those are definitely some terms that you're going to hear when you come in here. Let's start back up at the beginning with an insurance premium. You think, okay, what is that? The insurance premium is something that you're going to pay on a monthly basis just to be able to hold the policy, correct?
Correct.
Okay. So once that's done and over with, you come to physical therapy, you come see us, and I'm going to check your benefits. And depending on your plan, you may have a deductible. I know with Medicare, annually they have their deductible. This year it happens to be $226. That first $226 is your responsibility, and then Medicare will kick in unless you have one of those supplement plans that is going to pick that up for you.
Correct.
Okay. Once that deductible is taken care of, regardless if it's your responsibility or if the supplement picks it up, then it kicks into the co-insurance, which is, you said 20%, which is what we see here. If you don't have a supplement plan to help pick that up, typically right now for this year, we're seeing each office visit kind of ballparking between $16 to $18. That's not bad to come to physical therapy to feel better. If you've got the supplement plan, they're going to kick in and pick up that 20%. So then you wouldn't have anything out of pocket. And I know there's different plans. There's
Sure.
the plan.
They have letters.
Yeah.
So Plan F is kind of the Cadillac of the plans. Not to confuse you, they did away with it, but people are grandfathered into it.
Yes.
So if you're new to Medicare, you can't get it. It's also the most expensive for that
Mhm.
reason. But yeah, I mean, the two most common ones outside of that are Plan N and Plan G.
Yes, we see a lot of Plan G. If you have one of the Advantage plans, you're going to have, like Dan said, a copay, and that it can vary. Like you said, it depends on the plan. It depends on if we're in network or out of network with that plan. Thankfully, we are in network with most major ones. We're still out of network with a couple. But even so, with those ones, we found that their out of network benefits are very comparable to their in network benefits. So there typically is not an issue with that. So you're going through treatment, you're feeling better. I get the question all the time, how many visits do I have? How much money is Medicare going to allow me? Medicare does have a cap. Do you want to explain that?
So I'll let you go first from
Okay.
your perspective.
Sure.
And then I'll maybe fill in to.
So as far as physical therapy is concerned, Medicare has a dollar amount that they allow for you to spend. It's not a hard dollar amount that they stop you at. It's still based on medical necessity. So as long as you are still continuing to make progress, but the medical necessity is still there for us to treat you, Medicare will cover it.
Yeah, so I think what she's getting at is Social Security. They have standards, or I guess caps is a good word, for all these different types of procedures, and especially when it comes to physical therapy, if they don't deem it's going to be medically necessary, it's why they don't cover the dental, vision, hearing, because unless it's life threatening, they're just not covering it. Yeah,
makes sense. Another term that you're going to possibly hear, especially if you have one of those Advantage plans, is an authorization. Once we have your initial eval and we've got all the information with your treatment plan, I then take all that information and I submit it to the insurance. They review it and they say, okay, we'll give you X number of visits. Now, I know with certain plans, I know exactly what they're going to give me off the bat. Other ones, I kind of, they catch me off guard, and I was like, oh, okay. Either that's a good thing or a bad thing.
Right.
I don't know. Um, so we'll do an authorization. Like I said, they'll give you so many visits, and that doesn't even mean that's the end of treatment. I can always put in a request for an additional authorization for more visits, and they typically will. They monitor that closely. They look for the medical necessity. Some patients get a little frustrated by that. We get a little frustrated by that because it's, they're kind of dictating
Sure.
their treatment and their progress. But it is what it is.
And to that point is on the customer side, and again, this is specific to the Medicare Advantage. Um, Everyone that signs up with Medicare Advantage, they're going to have basically, I guess they call it a not a life coach, but somebody that So say you signed up with Humana, you're going to have a direct connect in Humana.
Okay.
That's going to call, reach out to the client. They're going to help you set up your prescriptions. Specifically, if you're doing mail prescriptions, they're going to walk you through the plan. They're just going to be a point of contact. And so I always recommend before you even start any type of treatments, you could reach out to that person and say, hey, I'm thinking about going to this doctor for this reason.
Okay.
That's a kind of, they get the authorization on that end as well.
Okay.
And so it's just, you know, I know from what I hear on the kind of the customer acquisition side is people are maybe, like you said, thrown off a little bit of, oh, what do you mean this doesn't cover it? So it is avoidable. You could definitely have that conversation before.
Yep. And it's something that you kind of touched on a little bit. You said, getting the approval from the doctor. As far as South Carolina is concerned, for physical therapy, we are direct access, which means you don't need a referral to come see us, which is a great thing. You can just walk in off the street, say, I want to be treated. We get you on the schedule. You're ready to go. That being said, we do need a physician's signature on file within 10 visits or 30 days. So we would need a physician associated with your account, and especially with Medicare, in order to put on the claims. They need to see that physician's name on there.
Yeah, for sure. And then again, going back to the plans too, is the more whoever you're dealing with the Medicare, just be as transparent as possible, right? I think what happens a lot is you get all these calls. Trust me, I get it. You're getting 15 calls a day, and you're irritated, and you don't know what to do, and they kind of rush you. But I think most problems stem there because they don't know the doctors you're on, they don't know the medicines you're on, and so it is so important to know the exact doctor, the exact location, just so you don't run into those problems.
Yeah, I've had a number of people complain about, well, I didn't know.
Right.
They didn't tell me this.
Right.
So.
Yeah. So yeah, I mean, is there anything else you would like to talk about?
I don't think so.
Okay. Well, we plan on doing this, definitely throughout the remainder of the annual election period here, which is kicking off in a couple of days. So I know that Holly's going to blast this out, I think, through email. And if anyone has any direct questions, obviously you have Holly's number. I'm sure I'll put my number in that email as well. Definitely. And we're obviously based here in the Grand Strand. And if there's any other questions you guys have, feel free to reach out to us and stop in and see Holly and the team here. And look forward to doing this again.
Absolutely.
Yeah,
Thanks, Dan.
Yep.
Thanks, guys.